San Antonio, Texas is the headquarters for Texas Bariatric Specialists. This was where our first office for medical and surgical weight loss was created. And I'm proud to be a weight loss surgeon in San Antonio. Collectively, the surgeons within San Antonio provide some of the safest weight loss surgery in the entire country. When I first got here about 4 years ago, I was one of the first weight loss surgeons in San Antonio to start thinking about things in a different way. The way I started thinking about things were from the way a fellowship-trained surgeon who is specifically trained in just bariatric surgery looks at an equation, rather than doing things the same way just because that's the way we've always done it. And to make these changes, it was difficult to do because the community really wasn't ready for it. We were one of the first practices in the city to provide the one-stop shop. You know, these public seminars where you have to go in and be able to see a person talk about something, and you really don't get a chance to sit down and talk to the surgeon, shake his hand, and really understand what we're talking about. We did an end to that. I was one of the first surgeons that said that, well, we're just not going to do public seminars anymore. We're going to wind up doing the one-stop shop. You're going to see me, the nutritionist, and the psychologist all in one setting. I'll be able to talk to you in public if you want to because you don't want to make that commitment yet. But at the same time, if you really want to learn about it, why not shake my hand first and let's see what we talk about and see if we can meet all of the needs that you have and understand all the aspects as they pertain to you, rather than in a big auditorium with lots and lots of people listening to the same message, but never the message that was meant just for you. Other things that we did was to raise the standard of care in regards to the way that surgery was practiced in and of itself, by developing different algorithms where everything was in a regimented way, and that allowed us to be able to raise the surgical complexity that we often offer. For example, we were one of the first groups in the city to routinely offer revision surgery laparoscopically. Before, if you had a failed weight loss surgery, particularly a failed stomach stapling, you would wind up having to have the same old big incision. But I was one of the first surgeons in the region to offer routine laparoscopic revision of these failed procedures. And these techniques became better and better refined, and now almost 95% of the revisions that I do are all done laparoscopically as well. When we took all of these things together, I realized that, you know, bringing surgical expertise into the region was just one aspect of this. But then the other thing that I think I helped do was to be able to bring the human side back to this. And some of the things that I was looking at that were happening in a big city, one of the largest cities in the country, was that medicine was becoming more impersonal. You know, and I realized that some of my competitors won't see a patient if they don't have insurance. And if you do want to sit down with a surgeon, they want $300. We have a $25 to $75 fee anytime that you want to sit down and talk to us. One of my competitors turned down follow-up patients because their insurance changed or they weren't participating anymore. And we saw that person for their $20 copay. One of the patients that came into my office said that, hey, you know, this deductible is huge. I'm not going to be able to do this before the end of the year. My insurance is going to change. Will you work with me on my deductible? And the surgeon said no. And we wound up making a payment plan with that person. And if we get that money, we get it. If we don't, we don't. But at least we got you the operation that you needed because this was a once-in-a-lifetime opportunity for you. And I respected that. So these different kinds of personal things, to be able to just understand where you're coming from, is really what's helping us stay different than everybody else. Each year, my accountant and other people come advise me in regards to the risks and benefits of doing certain types of procedures and what insurances are doing with different criteria for weight loss surgery. And we remain committed to one thing. We want to take care of everybody. We have no exclusion policies. We will see anybody at any time. We don't care if you have $1 in your pocket. We'll wind up seeing you to be able to educate you and at least be able to tell you this is where you need to go one day. Now, this doesn't mean that we're going to operate on just anybody, but it does mean that we really want to keep this as a personal relationship between me and you. And that's really important. One of the few surgeons in this city, like myself, will be able to sit down with you and go over your entire insurance benefit. And I'm going to give you a projected surgery date to say, hey, based upon your insurance criteria, we should be able to have your surgery done within a certain period of time. And this is the date that I'm giving you in general, let's say 6 months from now, 4 months from now, 2 months from now, and I'll give you my card after we're done with that consultation. I'll request that you email me at any time when any member of my team lets you down in regards to us and the commitment that you and I made with each other. When we shake our hands, that's a commitment. We know each other and we've committed to each other, and that's really important to me. And that commitment is going to withstand any test of anything, whether it be geographically or whether it be monetarily. We will figure it out, and we will figure it out together, because your long-term outcomes is something that we remain committed to.